Yes, hi everyone, this is Dr. Khan, Executive Plastic Surgery. So as you will see, Maureen, we have over here on the right side an implant from a 72-year-old patient. She has had 4 sets, the first one in '83, and then she's subsequently have them changed over the years. The last one that I wrote down, now I cut out the excess skin, the scar tissue, and as you can see, this is the end block that she had, grade 3 contracture. Now one thing I want to show here is, look, a lot of Ethibond suture. This is braided, thick suture that was there to hold the tissue. It was on the chest wall. So I removed all of this. There's a lot of inflammation. So she was not able to tell me if she has silicone or saline. Certainly this is what is consistent with silicone that I see. Now look at all this suture. I want you to appreciate this. This was used to tether this onto the chest wall. And you see, look at this, all of the suture, very thick, ropey type. Literally, you could, very thick, as you can see right here. All of the suture removed. Remember, the goal is to remove all foreign body, and this was done in the en bloc fashion. Blood loss was like 3 cc's. You can see the calcifications. These are a set of implants from the early 2000s. And so as you will see, as I go in, she had medical issues that brought her here, so you can see relatively large implant, done en bloc, the gold standard, and very much intact. Some fluid here. Remember, none of this spilled into the chest. And you have, this is your McGann implant, and there is no volume written on it. We're going to check the other side, but as you can see, intact implant. I'm going to go ahead and look. There is no volume that I'm able to read. But overall, the goal here is, look at the bottom. Look at this. This is very interesting. Look at these dark pieces of scaly fish, if you will. Now, look at this. We have not seen this. This is like a lizard's skin, hard, and you get these dark brown pieces of scaled calcium. Why they are dark, we do not know, but the pathologist and certainly the microbiologist is going to weigh in. You can see how hard this is, all done en bloc. You can see these patches, these small islands of this dark matter. Look. And so I'm going to go ahead and send this off. Obviously, one of the differentials is it could be indeed mold. Look at this. We have not seen this before. I'm going to go ahead and change my gloves so I don't cross-contaminate. Then I'm going to go look at the left side, the left. And as you will see right here, similarly, gold standard, which is the en bloc, 8/14/23. Very compressed. And again, as you will come in, Maureen, over here, look at the suture, lots of it. This is the braided suture, it's non-dissolving, and as I go in, you can see it starts all the way from here, and it's used to anchor this onto the chest wall. So all inflamed tissue, all the scar tissue over the years. Look at this, so thick. I don't think I've seen this high a concentration of the suture. And see, look at the, all suture must be removed, all foreign body must be removed, and all inflamed tissue must be removed. Remember, all these reconstructions she has had over the years, all of this tissue is unhealthy. You can see this is, if I go even touch it and feel, see of the consistency is not good. So as I go and dissect, now I'm going to go ahead and go in from here. Very interesting on the, you can see the suture. Look at this, please come on in, Maureen. Look at the suture is right in the proximity of the implant itself, which is not good because the suture is going to be cutting right into the implant, like you're cutting into cheese with that suture, if you will, over the years. So as you can see right here, as I pull the implant out, Look at this fluid. None of this spilled into the chest. It has this crystal salt type of consistency, and you will see what I'm talking about. All of this preserved. Now hopefully I can tell. This is your 550, and that certainly looks like that too. Look at the way this is a little bit more yellow than this one, as if it was going to rupture. So 550 Mentor intact implant. Let's go ahead and look on the inside. Look at this again, the same black islands that you see calcified. Look at this right here. Again, we're going to send this off to pathology, entire capsule. None of this broke, and you can see this is not healthy. If I go like this with my scissor, it's hard, calcified. All of this bad inflamed tissue was removed. Implants are not safe. This 72-year-old lady was in a lot of misery, and we'll see how she does post-op. All of the inflamed tissue, foreign body, all done en bloc, the gold standard, and we'll see how she does post-op with her many signs symptoms. Interestingly, she's from Nevada. She came with her family member a few months ago. I examined her. Now this is where, given her history, heart issues, I have had to bring her at the hospital just to be absolutely certain and safe. So there you have it, en bloc, the gold standard. We'll see how she bounces back. There is no other better way of doing it. Again, look at this consistency. This is very odd and very interesting. And we'll see what the pathology shows. This is Dr. Khan, Executive Plastic Surgery. The 100-100-0 rule, 100% of the time, 100% of the capsule is removed in the en bloc fashion, preferably, or 100% total capsulectomy, in this case the en bloc, and such that we basically get to the bottom of it, and 0% of the capsule remaining behind. This is Dr. Khan, Executive Plastic Surgery.